Acetylcysteine. Its role in paracetamol poisoning treatment and application in respiratory diseases. Acetylcysteine is a widely used drug in medicine, with two main roles: to detoxify the liver in cases of paracetamol poisoning and to thin mucus in respiratory diseases. 1. The role of acetylcysteine in paracetamol poisoning treatment. Paracetamol is a common painkiller that is safe when used in the correct dosage. However, when taken in overdose, paracetamol can be toxic to the liver, even leading to acute liver failure. 1. The role of acetylcysteine in paracetamol poisoning treatment. The mechanism of paracetamol toxicity is due to the formation of a toxic metabolite called N-acetyl-p-benzoquinoneimine NAPQI. NAPQI is formed from paracetamol via the main metabolic pathway of the liver. When the dose of paracetamol increases, this metabolic pathway becomes saturated, leading to the accumulation of NAPQI. NAPQI then reacts with glutathione, an important antioxidant in the liver, leading to decreased glutathione levels in the liver and causing liver damage. 1. The role of acetylcysteine in paracetamol poisoning treatment. Acetylcysteine plays a crucial role in the treatment of paracetamol poisoning by 1. The role of acetylcysteine in paracetamol poisoning treatment. Maintaining or restoring glutathione levels in the liver. Acetylcysteine is metabolized into cysteine, a precursor to glutathione. Cysteine helps the liver synthesize glutathione, which helps neutralize NAPQI and protect the liver from damage. 1. The role of acetylcysteine in paracetamol poisoning treatment. Minimizing the formation of NAPQI. Acetylcysteine can compete with paracetamol in the main metabolic pathway, reducing the formation of NAPQI. For best treatment results, acetylcysteine therapy should be started as early as possible, ideally within 12 hours after taking an overdose of paracetamol. 2. Application of acetylcysteine in respiratory diseases. Acetylcysteine is also used to thin mucus in respiratory diseases such as bronchitis, pneumonia, cystic fibrosis, etc. 2. Application of acetylcysteine in respiratory diseases. The mechanism of action of acetylcysteine in this case is to reduce the viscosity of mucus by breaking down the disulfide bonds in the structure of mucus. This makes mucus easier to expel from the respiratory tract, reducing airway obstruction and improving breathing. Note: acetylcysteine can cause some side effects such as nausea, vomiting, diarrhea, skin rash, and difficulty breathing. However, these side effects are usually mild and transient. Contraindications. Acetylcysteine is contraindicated in the following cases: people who are hypersensitive to acetylcysteine or any component of the drug, people with a history of asthma or allergy to acetylcysteine drugs. Precautions using acetylcysteine in respiratory diseases. Caution should be exercised when using acetylcysteine for patients with a history of asthma or chronic obstructive pulmonary disease. Precautions using acetylcysteine for children. Consult a doctor before using acetylcysteine for children, especially infants and young children. In conclusion, acetylcysteine is an important drug with two main roles: liver detoxification in paracetamol poisoning and mucus thinning in respiratory diseases. Using acetylcysteine should follow the doctor's instructions to ensure treatment effectiveness and safety for patients.